Hi, my name is Sabrina Clark and I'm a music therapist at Melody Music Therapy. We provide music therapy services to the greater Charleston area. The number one question I receive as a music therapist is, what exactly is music therapy? Well, music therapy is the use of music to achieve non-musical therapeutic goals. Music therapists can serve so many different populations. These populations include patients in hospice, in outpatient and rehabilitation centers, in the hospital, in school systems, adult and child daycare programs, preschools, and babies in the NICU. Really anyone who loves music and has a goal in mind. And music therapy is not just putting your AirPods and listening to a song or singing along to your favorite song on the radio or going to a concert. Although these things do bring us joy and do include music, they are not considered music therapy. And music therapy is evidence-based and it must be done by a board-certified music therapist like myself. And I have a few examples today of different interventions that can be used in different music therapy sessions. To start out with, I'll give you the idea of kind of what a session looks like for a child. The beginning of a session will start with a hello song. This allows a child to get oriented to the session and ready to learn. And after that, I really like to do a movement activity. This gets all the wiggles out so they can focus for the session. Next, I love to have instruments involved, do a little instrument activity. These manipulatives really keep the little ones engaged. Next, I love to do an academic song with visuals. And then after that, I'll bring the instruments back out. And I will end the session with a calmer song, maybe something with sign language, and finally concluding the session with a goodbye song. The structure of these sessions is very important. It allows the student to anticipate what's coming next in the session, as well as giving them a routine that they really feel that they can thrive in. So today I'm going to be doing two different interventions for the younger kiddos, and the first one is a rhythm intervention with instruments. And this intervention incorporates using instruments to increase focus and direction following. And it goes something like this. Please pick an egg from the bucket. Please pick an egg from the bucket. Please pick an egg from the bucket. You chose yellow. Today, we are going to sing a song about an animal that lays eggs. Oh, I know a chicken, and she laid an egg. Oh, I know a chicken, and she laid an egg. Oh my goodness, it was a shaky egg. Play them fast, play them fast, play them fast, really fast, and stop. Oh, you know a chicken, and she laid an egg. Oh, you know a chicken, and she laid an egg. Oh my goodness, it was a shaky egg. Play them slow, like a turtle. Play them slow, and stop. Oh, I know a chicken, and she laid an egg. Oh, you know a chicken, and she laid an egg. Oh my goodness, it was a shaky egg. Play your eggs, 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 and stop. We're all done, we're all done, we're all done, we're all done. that is just an example of one of the many instrument activities I like to do. And in between each intervention, I love to give a transition song just to keep the kids' attention. And that song sounds like this. What should we do next? What should we do? What should we do next? Bum, bum. And the next activity I have is working on increasing emotional expression. I have different cards to show different expressions and emotions. The first one is scared, happy, surprised, sad, angry, and silly. And I will choose 2 different emotions for the student to choose from. I have scared and happy to choose from. And the students will pick the correct emotion for the event. And it sounds like this. How would you feel today? Feel today, feel today. How would you feel today if someone shouted, boo? The child would then choose from scared or happy. And of course, hopefully the child would choose scared. And they would respond with, I feel scared. And there are a lot of different events that they can learn about. The next one is, if it was my birthday. And next we have, if someone stole my toy. And we also have, if I hurt my knee. This allows the students not only to choose the correct emotion, but to learn what the correct emotional response is to these different situations. So that's an example kind of the structure of a session for a kiddo and some of the interventions I like to use. The sessions for adults and teenagers looks completely different from the kiddos. It does have a few similarities, but the content is very different. It will begin with a hello song as well, just to get the client oriented to the session. And then there's different activities we can do with emotional expression. We can do things with relaxation. We can have an academic component, and we always will end with a goodbye song. And the session and the intervention that I will be doing an example for today is Born This Way by Lady Gaga. This song we will utilize to increase self-image and self-confidence. My mama told me when I was young, we were all born superstars. She rolled my hair, put my lipstick on, in a glass of her boudoir. There's nothing wrong with loving who you are, she said, 'cause he made you perfect, babe. So hold your head up, girl, then you'll go far. Listen to me when I say I'm beautiful in my way, 'cause God makes no mistakes. I'm on the right track, baby, I was born this way. Don't hide yourself and regret, just love yourself and you're set. I'm on the right track, baby, I was born this way. Ooh, there ain't no other way, baby, I was born this way. Baby, I was born this way. Ooh, there ain't no other way, baby, I was born, I'm on the right track, baby, I was born this way. After singing through that song with the client, I will hand out a sheet of the lyrics that has fill in the blanks, and through this the client will be able to fill in the blanks with different events and different things that pertain more to their life. And once these lyrics are filled out, the client and I will sing through the song with their own lyrics, and this will make it more personal and pertain to their life better. And then we will set 3 goals for that week and how we will use these goals to facilitate an increase in self-image and in self-confidence. So that's an example of an intervention I would do with a teen or a young adult if that was the song of their preference. So overall, music therapy is an extraordinarily powerful tool, and you can really achieve any single goal with music therapy. If you have any other further questions or you just want to learn more about music therapy, please feel free to visit us at www.melodymusictherapy.com, or feel free to email me directly. My email is sclark, C-L-A-R-K, @melodymusictherapy.com. Thank you so much, and I hope you all have a great day.